Good afternoon, everyone, and welcome to the July monthly General Thoracic Surgery Database webinar. We hope you are all doing well and wanted to take this opportunity to thank you for all that you do. On the call today, we have from the STS myself, Leanne Jones, Database Manager for the Thoracic and Congenital Databases. We have Carol Crone, Senior Clinical Manager for the STS National Databases. Also from the STS, we have Jane Hahn, Associate Director of Quality, as well as Addie Dolan is on the call from STS as well. From IQVIA, we have Melanie Bent, Jeanette Hanna, Paul Meehan, Jean, Joe, Michelle, and maybe some other IQVIA colleagues on the call as well. I'm going to run through the agenda real quick, and so we'll touch on a few housekeeping items. We'll have an AQO update, an IQVIA update, and then we'll have some Q&A. And just a friendly reminder to please submit your questions using the Q&A function. For our housekeeping items, the July training manual has been updated and posted. The STS and General Thoracic Task Force are continuing work on the 5.21 data version upgrade. The data collection form is currently being beta tested by the core group. Once the beta testing has been completed, the STS and core group will bring feedback to the surgeon leaders for discussion. And then once the final core group and surgeon leader review is complete and the DCF is finalized, Carol and I will then begin the next steps of working with IQVIA on data spec creation, and we will also begin work on the training manual. And as of right now, at this time, we are still planning a go live of January 1, 2021. On Thursday, July 30th, we will begin our quarterly new data manager webinars. That call again is scheduled for July 30th at 1 p.m. The sessions will be beneficial for those new data managers or perhaps data managers that are still fairly new within their role, or maybe even some seasoned data managers that may want to review. This session will essentially be a back to the basics session. We'll be discussing how to access resources available to data managers, how to use your software specs, your data specifications, the training manual, how to submit clinical questions, understanding the DCF, et cetera. Again, it's just going to be a very back to basic session for new data managers and where to start. All right, next we have some important dates for General Thoracic. On July 1, the General Thoracic web user interface direct data entry went live. On July 22nd, we have our next thoracic user group call. August the 12th, we will have our next General Thoracic monthly webinar. Summer 2020, we're expected to have the spring harvest risk-adjusted results available, and that will include procedures up through December 31st of 2019. September 18th, the fall 2020 harvest will close, and that will cover procedures up through June 30th of 2020. And then on September the 30th, we'll have the General Thoracic Surgery Database session for AQO. And then again, January 1, 2021, we have the 5.21 go live. And again, as you may have heard on previous webinars, STS now has a direct data entry option available within the IQVIA platform. This data direct entry option, again, was released on July 1 and is now available. If you would like more information on the direct data entry option, please email us at stsdb@sts.org. And we'll be happy to get you some more information on the direct data entry option. Next, we'll have a quick, I'll provide a quick AQO update. The General Thoracic AQO session, again, will be held on Wednesday, September the 30th. We hope to have abstract submission and registration open by next week. An email will be going out to all data managers with more information shortly, so please keep an eye out. We've included a QR code here if you'd like to use that to easily access AQO details and updates. And in case you haven't heard, AQO 2021, fingers crossed, will be held in Denver. So we are still planning as of now for this to be an in-person meeting, and I hope we are all able to get to Denver to have our 2021 AQO in person. Next, I'll turn things over to Melanie Bent for our IQVIA update. Mel?
Thanks, Leanne, and good afternoon, everyone. Let's go ahead and let's review upcoming items of what's available now and what's coming. So for July, we do have a couple of updates. The first one is, of course, what Leanne just reviewed in regards to the direct data entry that's now available within the platform. So I know that we have some users that have started with that process. Next available item that is available is the critical summary report, and I'm going to review that today. I'll show you how to access that if you have not seen it already. And that is a new report that is integrated into the current data quality report. So I will share some screenshots and then also do a demo so that you're able to see how to access that and how to get to that information. We do have some defect fixes and improvements that are coming. We do have those scheduled for the August timeframe. I will review items that are that will be included in that upcoming release. So we'll review that and then also review some items that have been submitted by users and those items that are currently in progress under review. Also in August, we will be doing a platform update. Again, that's just in regards to just the base platform and any enhancements. And when we deploy those changes, of course, we will have those items listed within the notification section. And then also we'll be sharing that information with the vendors, just in case if we have vendors on the call, that information will be shared with vendors too. Let's go to the next slide. All right, so the issues list, just so that we are aware of currently what are the known issues, we'll go ahead and review those, and these are targeted to be reviewed and of course included in an upcoming release. The first item we have here is a message that is appearing as a I believe it's an error that is showing in regards to the race not documented. This is specific for demographic data versions that are prior to 2.3. The message will appear for those records. We are aware of it. So that is STS 3219. So we will be getting in that update to make sure that we're addressing the earlier demographic versions. The next item is specific to the dashboard, which is 2209. There were identified operative calculations that we're showing specifically for the 2.3 data variables. I will post this information in the notification section and give more specifics that's related to 2209, so you know specifically. So, but we do have this as a known issue, and again, this is targeted to be fixed within the upcoming release. And then the last item on this list is for the missing variable report, where the percentage is displaying as a gray box. This does not happen across the board for all users. It seems to only occur in certain instances where they're seeing a gray box and there is no percentage value that's showing in that entry in that cell. And then the total case count actually does not give you the total case count information. Again, not across all users that have, all users have not seen this, but we have seen this represented on a couple of different sites. So still wanted to raise that so that others are aware. If you do see this, we are aware and we'll get it in a fix. Let's go to what's under review. Next slide. I just went ahead and put these in buckets, and again, we're reviewing these on just the sites that have reported these specifically. There have been certain scenarios that have only been reported for a specific site. So the first area is in regards to the missing variable report. It's more so in regards to the there is information that is not showing up in the case form, but showing up in the actual DAT file. So we're looking at those at a case-by-case basis, and those IDs that are listed there are the ones that are under review for missing variable. And then for the data quality report, those are related to specific warnings and errors for specific records. So we're looking at those individually. But these, again, are more so specific to sites that have reported those. And so we're working with the support team to make sure that we're able to provide resolutions for those. Let's see. Let's go to the next slide. I think we are going into the report now. Yep. So a new report is available now within the platform that's called the Critical Summary Report, and that is going to be included in an existing data quality report. So the way that you would access the critical summary is the same way that you would access your data quality report. So from the uploader card entry, you will have your view reports link. So again, same way of how you would get to the DQR, select that link and the DQR will load. And there will be a new critical summary tab within that report. And that's available on the lower left corner. So I'm going to go ahead and show you where that is on the next slide. So let's take a look there. So once the report loads, if you look at the very left side of the screen, the lower left side, you'll see that there is another tab that now appears, and it's called Critical Summary. Once you select that tab, it's going to open up a new interface for you. So let's go ahead and let's take a look at what that will look like. So next slide. So as soon as you select that tab, you will see this new report interface. You would enter in a from date and to date, and this will allow you to review all of your submissions that you have done in one centralized area. So instead of having to review each individual submission, so going to each individual uploader card entry, you're able to see all of those submissions in one centralized area. And so any DQR that you open, if you wanted to see this information, this report will be available for you. Once you enter in your from date and to date, it will list all of the respective submissions that you've done for that time frame. It is going to show you if you have any submissions that have failed, and then of course any that have passed. If you don't have any that has failed, then you will only, of course, see the items that have passed. And the reason why I call that out is because if you notice on the left-hand side, there is a filter that's called File Status. And the file status will be where you will see options for failed or passed. If you do not see any option listed for failed as an actual filter, that means that of course you don't have any failed entries. Okay, so that filter updates accordingly. So looking at the report, you'll see that you're able to see, of course, the submission date, the upload ID, the first surgery date and last surgery date. We actually had gotten feedback from the user community to say, is there a way for us to be able to see the initial record, that surgery date, what is that first date, and then what is the last date that makes up the submission. So we are providing that here. You're able to see that date range. Then, of course, you would see the file status, and then another area that has been asked to be provided is being able to see how many records were included in my submission. And out of the total records, how many of them were successful, or how many of them were considered failed. And then, of course, any of the records that did not change within that set. So as you can see here, we do have in that very first entry that I've highlighted, in that submission it had 3 records, and out of the 3 records, 3 were successful, 0 failed, and 0, there were no changes. So you're able to see that. And then you'll notice that at the very last column, if you wanted to go to that specific submission, that specific data quality report, you're able to click that hyperlink, and that is going to open up that data quality report. So you're able to review that. The other thing that you're able to review, of course, is if you did have any records that failed, if you had any critical validations related to that, once you select that line item, you're able to see the critical information, those records, down in the bottom section where it says critical messages. And so that information will stay up to date. If there are any updates to those records that were done after that submission, you will see the most recent critical validations related to those records. So that information will stay current, so you're able to review that quickly. So what we can do is just take a look. We'll just do a quick real-time demo of accessing the report so that everyone is familiar with how to get to it and how to of course, view that information. Give me one moment and I will share my screen.
I stopped share, Melanie.
Okay, thank you. Let me just bring up the window. Okay. All right, you should see the uploader interface.
Yes, we see it. Thank you.
Okay. And let me just close, I'll close that so we can just open it. So once you're reviewing your entries, and now that we'll just take this first entry here that I have, I will select View Reports. And once you're in the report, I just want to point out this is where that new report for critical summary is located. Okay, right down here. So I'm just going to go ahead and select that, and you'll notice that you have your date entries. So what we would do is just put in the dates. And I'll put in through, I believe I have through April. And then I'll run the report. And again, it's going to pull up all of the submissions within that date range, and you'll see those listed here. So I do have passed and failed, and since I have a failed entry here, you'll notice here, I do have a filter available to be able to view just my failed option. So I'm going to deselect the passed, and if I wanted to just view my failed, I can go ahead and use the filter to do that. Okay, just wanted to show that. So here again, just wanted to point out, because this was a question that has come up before, is how do I get the total number? How can I confirm how many records were included in my submission, and how can I confirm out of that submission all of the records that were successfully saved to the database or failed? And then of course the last option in regards to no changes. So all of that information is available here. And then if you wanted to go to that specific data quality report, you would select that link and it would open up to that actual report. Okay, so this is it here. I do want to raise an item just so you know that we are reviewing it. This came up today. We did notice behavior on the data quality report. Of course, when you select the pie chart, it will of course select all of the items for the respective errors and warnings, but we are noticing and we are looking at making sure that this is included. This just came up today where the deselect option is not working as expected. So that is something that was raised to us, and I just wanted to make sure that you all know that we are aware of it and working on getting that resolved. So right now it will of course select all of the items and it will display all of the results down below for you to be able to of course export, but just wanted to point that out. Okay, I will stop here. That is what I wanted to cover to make sure everybody is aware of this new report. And you're able to go in and take a look at that if you haven't done so already. Okay, so I'm going to stop sharing. I'll send it back to you, Leanne.
All right, thank you, Melanie. And you should be able to see my screen.
Yes, I can see it.
All right, perfect. All right, thank you, Melanie. I appreciate it. All right. Next, we're just going to review some slides. You guys have seen these before. The IQVIA support plan. Again, we here have the excuse me, the phone number for tech support, as well as the tech support email, ststechsupport@iqvia.com. Once you contact tech support, you'll be connected automatically with Tier 1 support. Tier 1 support is live support available 8 a.m. to 8 p.m. Eastern Time, Monday through Friday. Your questions will initially be addressed by Tier 1. If Tier 1 is unable to answer your questions will then be routed to either Tier 2 support or to STS accordingly, depending upon the type of question. Tier 2 will respond directly to you, or STS will respond. If your question requires additional assistance that involves the analysis, analytics, STS will follow up with DCRI for additional information, and then we'll respond accordingly. Also, Tier 1, if there were any technical issues that they needed to address with a database vendor, they would work with the vendor if needed. Also, this IQVIA support plan is also posted out on the STS website under your resources as well. And again, just in terms of resources, again, we've all seen this slide before, but we just provide a list of the resources that are available out there for you. You have the STS National Database webpage, STS Tech Support at IQVIA, and the phone support number. We also have the STS National Database feedback form available for you. We encourage you to use that form to provide us any feedback, good, bad. Let us know what's going well, if there's anything we could improve upon, things that you'd like to see. But again, please use that form to please let us know how we're doing and how we can assist you better. Resource documents available available for you out on the STS National Database Data Warehouse Transition page. You have contact information, webinar information, our FAQs, the Go Live checklist, our tier level support document, as well as there's training videos and a link to IQVIA as well. As always, here is my direct contact information. Please do not hesitate to reach out to me directly with any questions or concerns. You can reach me directly at ljones@sts.org. You can feel free to call me directly at 312-202-5822. Again, if you have any database operational questions regarding your contracts, participant contact information, direct data entry questions, please email us at stsdb@sts.org, and we'll be more than happy to help you. Before we get into our Q&A portion, I just wanted to give the dates again for our next General Thoracic webinar, so you can mark your calendars accordingly. Our next user group call is scheduled for July 22nd at 2:30 p.m. Central Time. And again, our next monthly webinar for August is scheduled on August the 12th at 1:30 Central Time. All right, so next we are going to turn things over to you all for our open discussion. Again, please use the Q&A function to submit your questions. We'll answer as many questions as we can, and we do encourage your feedback, so please just let us know. All right, we have some questions coming in, so if the team's ready, we'll go ahead and start tackling some questions. All right, our first question. When will vendors be supplied the specs for the new General Thoracic data version? So we hope to have the specs to the vendors early fall, and Carol and I are aiming sometime in August. So we're going to have a very busy month. Our next question, this looks like it may be for the IQVIA team. My understanding is that each time we submit a file, it submits all historical demographics data. If a historical record for a patient gets updated due to this, and those updates cause critical errors, that would prevent the historical record from being accepted by IQVIA. Will we be made aware of this?
So, this is Melanie. The historical information that we have we migrated over data for the past 2 versions. So if you're trying to update an existing record that we already have and you encounter a critical error, that historical record that's in the IQVIA platform is still there and is not updated. So no change has happened there. Once the critical error is resolved and you resubmit, then the historical record that we have in the system would then be updated. Okay, but just know that if we have, through data migration, if we have that record already in the system and you're trying to do an update, but you're blocked through a critical, the historical record is still there, no changes are made. Hopefully that answered
Great.
that question.
Yep. Thank you, Melanie.
Mm-hmm.
And actually, our next question, someone wants to know if you could show, do a run through of how to use
Harvest
the
summary?
Harvest Summary report. Mm-hmm.
Yeah, I think we should have time.
Yeah.
Let's
Okay.
we can cover
Yeah,
it.
I don't see a lot of questions coming in. Maybe while you're pulling that up, I don't know, maybe if support could address this next question. For those who are working from home, how is IQVIA rep going to obtain our home numbers instead of phoning our office if we have issues or ticket in for issue?
This is Jeanette from the IQVIA side. So we would not have alternate contact information for you if you had not already provided that. So our team will do their best to follow up via email. And if there is alternate phone numbers that you would be preferred to be reached at, please do share that out in an email follow-up, but do mention your ticket number when you send any email, and if possible, please do reply on the original thread rather than starting a new email.
Thank you, Jeanette. Our next question, could you please repeat the dates for the new abstractor training? So I put the slide back up. Our first session will be held July 30th at 1 o'clock Central Time. And again, these will be quarterly webinar trainings. So again, the first one is July 30th at 1 p.m. Central Time. That's on a Thursday, I believe. Our next question will there be training on the harvest report? So on the risk-adjusted results that come back. So I do believe, yes, there will be some training. I don't know if IQVIA wants to address further, but
yes,
I do know there will be some training provided.
We would have training provided, and of course we would have documentation provided for that too. And then of course going through sessions like these, we would be reviewing it, but we will have trainings available.
Perfect. All right, our next question for direct data entry. How far back will we be able to enter data for the new direct data entry function for thoracic?
So we go back to the 2.3 version for thoracic. I can't remember the date when the surgery date started for that, but we support from 2.3 up until the current version, which is now 2.41.
Perfect. All right, our next question, I may have missed this, but when will the next report be published? We don't have an exact date yet. We are still planning for summer 2020. Once we get more information or can give a provide more information as soon as we have it, but we're still aiming for summer 2020. I don't have an exact date yet, but we are working with DCRI. The data is in analysis. I don't have any other questions yet, Melanie. I don't know if you want to go ahead and pull up the harvest summary report and give a quick demo.
We
All right,
can do
I'm going to stop share.
Okay, give me one moment.
All right.
And let me just take it from the top so everybody can see where I am. So going to the harvest summary report, you would access the operational reports menu. And from the operational reports menu, you would access the harvest summary, which is under the STS reports menu. So here you would just enter in a time frame. This is basically going to pull back the surgery dates based on the time frame that's entered here. And I believe I have data. This is a test environment or generic environment that I loaded up some data. So let's just do 2019. I will run that through the end of December 2019. Let's see what I got. So I'll select apply filter and let's see if we have any data. Yep, We have items. Okay, so here I am presented with the submission summary, which is going to give me any outstanding errors. If I had any outstanding warnings, that also would be listed here, but I don't. And then you'll notice that there is another category that's called no validations outstanding, meaning that these records have been identified as they do not have any errors or warnings, and those basically are ready to go. There's nothing for you to address. And so you'll see that the columns are shown here, error, warnings. We do have a column for no validations outstanding to basically show the entries that have no work that's needed for you to do. So here I will select on just the errors. Once I select on the errors, you'll notice that all of the items within the error column has been highlighted, and those items are now showing down below. So these are showing all of the records that have these existing validations. In this instance, it's errors that I need to address. And so when you review down below, you'll see that the record ID is also going to be presented, and then the patient ID. So I can just tell by looking at the record ID that it's basically the same patient. This one record has multiple errors that should be resolved. Okay. I can also export this list if I wanted to review this maybe in Excel. I could go ahead and right click on the section, and you'll notice that there is a menu that appears, and I have an option to export to Excel. If I'm not using Excel, I do have an option to export to table, which this supports other spreadsheet types of programs. Okay, so you do have that option if you're not using Excel. But here is the option if you wanted to export to Excel. Within the platform, within this report, if I wanted to review that actual case, I could select on the hyperlink, and it will load the case form. And in here, I am able to review, and my user has permissions to do edits. For those that are not, of course, direct data entry users, you will not have options where you're able to make modifications to the case form. You will only be able to review it in a read-only manner. So from that standpoint, basically, you can just ignore these items. What I want you to see is that you're able to review the associated errors by selecting this icon here. It's a little check mark. It's a clipboard with a check mark, and it's going to list all of the associated errors. If you select that error, it will navigate you to the section where it is basically prompting for a response. So you'll see that it basically brought me to that section. So if I were to select the actual error, it will bring me to the section where it wants a response. And you'll notice that those are blank. So it wants me to enter in those responses. Okay, so just know that you can use that to review those specific entries. And then let's see, if I wanted to also filter out, you'll see that you have the same filtering capability that you have within your DQR. You're able to go ahead and remove items that are non-analyzed or deemed as non-analyzed cases. You're able to go ahead and filter those out. But by default, it does bring in all of those cases, so you're able to see everything in one shot. But you're able to, again, filter those out and just focus on the cases that are deemed as analyzed or major procedure. All right, so I will stop here. Let's see if we have more questions that have come in. I'll stay logged in just in case if we want to navigate somewhere else, we could do that too.
Yep. Yeah, I see. With the current conversation, why does it populate a number and no validations outstanding?
And we did raise this before. We are looking to change that. Thank you for raising that again, just to make sure everybody else is clarified on this. We are going to update this. It is being used in the current moment to do the count, to basically just put in as a placeholder value, but it should not actually show a value here because it is misleading. So we are looking to update that so that it does not seem as if you have something that you need to address. If you do select it, it will actually just allow you to select it, but it does not give you anything because there are no validations. So we are looking at updating that so that it doesn't cause confusion.
All right. Let's see here, we got a couple of questions from Rhonda. I have 3 records showing no patient ID available when reviewing critical summary report. How can I identify the issue when each record is given a number when entered in Lumetics?
I would need to see the, I don't think I had that in my example. Let me just double check.
This is Jeanette. So I think in the harvest summary report, if you are seeing a indication without the patient ID, did I hear that correctly?
I think she was saying on the critical summary report.
Oh, the critical summary. So the critical summary, that can happen if there's something off in the file. So if you could double check the text around the message, it could be that we weren't able to fully process or review that record. And so we didn't have the patient ID to see it. That can happen also if you go to the critical summary tab, Mel.
Oh, let's go here.
There's also, for certain submissions, if it's a failed submission for some reason, those critical validations can show up without a patient ID, and that indicates the entire submission was not successful. So in that situation, as you can see, there is no patient ID here. So if you'd like to just take those out, if you had a failed submission and you've subsequently done submissions and those have been successful, there is that file status filter on the left. You can uncheck the failed option and it will take those off of your list for review. So this gives you the option to include them if that's helpful for you, but also to filter them out if you'd no longer like to see them.
Yeah, we may need to look at if did you say it was Rhonda? I'm not.
Yeah, it's Rhonda.
Yeah, we would have to see maybe the specific examples. I don't have any, unfortunately, to be able to show you. The only other thing that I remember when we don't have a patient ID that's listed is when the record was already processed, but you're saying it's critical. So I think we just need to take a deeper look. So if you haven't already contacted our support team, please do, and then we can just take a look and see what you're reviewing.
Okay. All right. We have another question here from Kelly. My data quality report is showing critical errors, but when I go to the critical summary and enter the date range of the data quality report, it is not showing any critical errors. Am I missing a step?
No critical. So the data quality report has criticals, but when you go to the critical summary, again, we probably just need to see.
So this is Jeanette. So the critical summary report is designed to show only critical validations that are still outstanding, not to show ones that have been addressed by subsequent resubmissions. So it's intended to give you a view of the submissions you're reviewing, what is still left for you to dig into, whereas the data quality report will be a point in time perspective. When I did that submission, what was my status right then? So it is possible that you've done a subsequent submission that included the successful submission of a record that previously had a critical validation, and then that would not show a critical error in your critical summary report. If you don't think that's what's happening, then I think, to Melanie's point, we would want to look more specifically at your situation and help better understand what's going on there.
Right. Thank you, Jeanette. Melanie.
Mm-hmm.
And here's someone wants to know if the harvest list, isn't the harvest list, the harvest summary, the same as what you would find in the missing variable report?
No. The difference between the two is that the missing summary report is going to give you, it's going to give you a list of variables that are missing in cases. So it's going to give you a summary of, and we can actually pull that report up so we can all just visually go through the process. But that is just giving you totals in regards to variables that are identified as missing on the case forms. Okay, the harvest summary is giving you all of the associated errors and warnings that are firing on the actual case form. So it's not that it's necessarily missing in that case. It's basically saying that there could be a conflict of based on the information that's listed in the field, for example. Maybe an age that was entered that exceeded. So you're going to get messages that are either an error level or warning level, whereas with missing variable, it is just going to show you cases that are missing the actual data. It's not answered. So let's just take a look real quick. I'll pull it up. We'll do for 2019. Let's see if I have stuff that's missing. Here we go. Yep. So here it's going to give you the actual variables that have been identified and the specific cases. So here is an example where one case was where it was expected out of 210. One case out of the 210 is missing a response for this field. And so once I select that, it basically will allow me to view that case and see that the field does not have a response. Okay, so that is basically all of what you're seeing here. That is what the report is letting you know. Okay.
Thanks,
And what else do we have? I would go back to the harvest. I'll just pull it back up, but basically harvest summary, again, just errors and warnings.
Yep. Our next question, are we ever going to be able to fix those errors right on the spot? So I think she's talking about fixing it within the IQVIA platform. You pull the case form up. But I'll let Melanie, you can address that.
Yeah,
if you
no. The changes that would have to be done, the corrections that would have to be done would have to be in your software vendor system. Because if you were to make changes within the IQVIA platform, that information is not transferring back to your software vendor system. So the workflow would be that you would, the IQVIA system would identify the areas where you would need to update, and then you would make those changes within your software vendor system, re-export with those changes, and then upload to the IQVIA platform. For those that are direct data entry, they do have the ability to, of course, enter in the data, and they're getting the validations real time when they're actually entering in the information. So that when they're using that side of the solution, you're able to do those real-time edits. But in regards to upload, you would have to go to your software vendor system.
All right. Thank you, Melanie. And our next question, where do we find an executive summary to provide to executives? It used to be called the STS Executive Harvest Summary, and these are posted out on the STS website. It's, if you want to email me directly, I can point you to the executive summaries. I don't know, to be honest, Melanie or IQVIA or STS team, if we talked about putting the harvest executive summaries within the IQVIA platform, but these have been posted. These are always posted out on the STS website. So I think the current practice is to continue to keep them posted out on the SDS website so everyone has access to them.
And we can actually post a link within the library. We can actually post a link.
Okay.
So Leanne, we can connect after the
Okay.
call and we can get that updated.
Yeah, that's a good idea. But yes, that is something that we can discuss and look into. So thank you.
Mm-hmm.
I don't see any other questions. We have about 10 minutes left. So if you have any other questions,
Actually,
here's one.
This is Carol.
Yes, ma'am.
Regarding the executive summaries, we are no longer posting those public. If sites need that information or are looking for that information, we could do a minor data request through the research center to get that.
Okay, perfect. Thank you, Carol.
You're welcome. It is also provided in their reports.
Yes.
Yeah, okay.
All right. Our next question, she's just saying that have to go to, we have the 3 different reports available, and why not simplify it and put it all in one place? We have different reports available that serve different purposes. I don't know, Melanie, if you all want to expand on that.
Yeah, that's correct. There's also, we have different users that will view the information, either have access or not have access. So that's another thing too. So we have role-based, so not all users are viewing all of the reports. In this instance, we have the data quality report, which is on a per submission basis. So every time you upload, you receive a new data quality report for that submission. So being able to see real time the validations and in regards to errors and warnings, for example, being able to see those on the whole data set, that is not available within that current data quality report. So we did have to split that out, and that is the harvest summary report. And then the other option, another report rather, of being able to review the missing variable report. Again, it's just focused on being able to provide the feedback of seeing what fields are not being captured on the case form, and just to give that alert. Again, that's not on a per submission basis. It is at a holistic time frame that you enter, and that's not available at the data quality report level. That again is just based on the submission. So that is the reason why we had to split those out.
Excellent. Thank you, Melanie. I'm not seeing any additional questions.
I'll stop sharing.
Come
I'm
in.
not sure if did you already share the slide for the next upcoming dates?
Yep. I've got the next dates again, our user group calls. These are all great questions. So if you, I highly encourage you to attend our user group call on the 22nd. So you'll have the opportunity to ask questions, how to use the harvest summary report. And if you have any questions regarding functionality of the platform, these user group calls are what these calls are for. So please try to attend those user group calls, and we'll tackle as many questions that you have about the database, the platform, the data quality report, the harvest summary report, how to use things, tips and tricks. So please, try to attend those. The next user group call on July 22nd at 2:30. And then again, our next monthly webinar is August the 12th at 1:30 p.m. Central Time. I don't see any additional questions coming in. So I just want to take an opportunity to thank everybody for joining us today. Thank you to IQVIA staff and STS staff for joining in. I appreciate your guidance and your support. So if we don't have any additional questions, I guess we'll call it a day. And thank you everyone for joining. And we hope you are able to join us on our user group call on July 22nd. Well, thank you everyone. I hope you all have a great day.